Hello everyone. Today we are here with Dr. Annu Susan George, Consultant Medical Oncology, Medcare Hospital. Hi doctor, how are you?
Good. How are you?
I'm great. So could you tell us a little bit about your journey into medical oncology and how it has shaped your approach to cancer care?
I had exposure to oncology very early in my internal medicine training. So at that time, I studied in a government college in Coimbatore in India, and we did not have any medical oncology specialists in the hospital. So we were involved in the care of the oncology patients. So that's when I realized that there's a dearth for these specialty in medicine. And that's when I decided I should take up this specialty. But when I got admission for it and I talked to my colleagues and my friends about it, they were all very surprised because oncology has always been perceived as a kind of a very depressing specialty, both for the patient as well as for the treating doctor, because there is not much hope. This is a general perception. But it's a very wrong kind of notion because oncology is one of the specialties of medicine where there is cutting edge innovation and literally we have new drugs coming every day. But it is also one of the specialties which is deeply involved with human care, and empathy is very important in oncology. So that is one of the reasons why I took up the specialty. And early on in my training itself, I realized the importance of a well timed diagnosis and a structured, evidence based care plan and very honest conversations with the patients. This can make a lot of difference in their care.
So what are the most common types of cancers you treat here in United Arab and do you notice any unique regional patterns within this Middle East region?
Yeah. So when you look at the spectrum of cancer in UAE, the most common cancers in males are generally colorectal cancer and prostate cancer and leukemias. While in women, it's mostly breast cancer, colorectal cancer, thyroid cancers, and uterine cancers. There is increased incidence of cancers in young people in the UAE, which is kind of very concerning. This might be because of the kind of obesity pandemic as well as metabolic diseases like diabetes, which are increasing. When you look at the statistics, cancer is a fifth most common cause of death in the UAE. But we're looking to reduce the mortality due to cancer by about 30% by 2030. That is our goal. And if you look at culturally, the difference when you compare with the West is that here the family is very much involved in the cancer care, which is, I think, a good thing, especially if it can align with the patient's choices as well.
So, are there any particular case or patient stories that have left a lasting impact on you?
One particular story is about three sisters that I've treated. And the eldest one was one of my very first patients when I started practice. That was way back about 10 years ago. She was diagnosed with breast cancer and she completed her treatment successfully. She was on hormonal treatments. She was continuing on hormonal treatments and on follow up. 3-4 years back, she came to me with a report of her youngest sister, a mammogram report, which is suggestive of cancer. And they came to my clinic. Three of them, all three sisters came. And the middle one also told me, like, as we were conversing, I also have this lump. Why don't I get it checked, doctor? So we ordered tests for this. And unfortunately, the second one and the youngest one also turned out to have cancer. They had a genetic mutation in their family, which is why all three of them got it. The youngest sister actually was a single parent and she was in financial distress and she was going through a tough time. But the resilience of all three of them, the support that they gave each other, all of them successfully completed their treatment. They're doing very well. That showed to me how compassion between relatives and support of the family is helpful, and how even with all these personal challenges, the journey of cancer can be easy if you have your family with you.
So, having worked internationally, including observerships at renowned centers like Cancer Center and Henry Ford Hospital, how have these experiences influenced your practice in the United Arab?
My international experiences have kind of reinforced the importance of a structured care pathway in cancer care. How important it is to have a disciplined pattern of right from diagnostics to the management of the patient. So I brought back this kind of checklist culture, you can call it. There is an emphasis each time that a multidisciplined tumor board has to be there involved in the cancer care for each patient before we actually start the first step of treatment. It has to go through an MDT. Then there should be reflex biomarker testing for whenever possible. You should integrate palliative care services as early as possible, and you should have a clear survivorship plan for each patient. So this is what my exposure to the international hospitals has helped in tailoring my treatment for the patients.
So, at Medcare, a multidisciplinary approach is emphasized. How do you collaborate with other specialists to develop personalized treatment plans for your patient?
At Medcare, we believe that the MDT or the Multidisciplinary Tumor Board is kind of the backbone for cancer care. We have a MDT which involves medical oncologists, surgeons, pathologists, radiologists, and a nursing as well as a support staff is involved. So each new cancer patient that comes to us is discussed in this tumor board, and we make a collective decision about the optimal sequence of management for this patient. So we have a single one strategy for the patient. So it's like a patient-facing strategy for each patient.
And what role does patient education play in your practice, and how do you empower patients to take an active role in their treatment journey?
So there is a quote like, if you give a man a fish, you can feed him for a day.
Right.
But if you teach him how to fish, you can feed him for a lifetime. This is the importance of education. So education is literally treatment. You can call it treatment. Because if you explain to a patient the why of it, then their anxiety considerably decreases and their adherence to treatment protocols increases. And also, I encourage the patients to bring a companion with them. It will make them more comfortable. And I also kind of ask them to always have a question set, at least a 3-question set for me when they come for each visit. They consult about red flag symptoms, so they will know when to go for emergency services. So there's no delay in that. So that is the importance of education and patient counseling. It makes it more easier for the patient as well as for us for treating.
So, the field of oncology is rapidly evolving. What recent advancement in cancer treatment are you most excited about, and how are they being integrated into practice at Medcare?
So, as I said before, oncology is one of the specialties where every day cutting edge innovation is happening. We're getting new drugs every day. So, what excites me most would probably I'll call it the version 2 of targeted therapy. We have had targeted therapy right from 2000s onwards with imatinib. Now we have the second wave of targeted therapy, you can call it. So, there's this spectrum called newer agents against HER2 low breast cancers, very difficult to treat kind of mutation called the KRAS G12C. That is very common, but we didn't have drugs for that. The EGFR resistant lung cancers, all of that have newer targeted agents. That is very promising. Then we have antibody drug conjugates, which actually the cytotoxic or the chemotherapy payload is directly given to the tumor cell. So that minimizes toxicity. So that's also very exciting. Then CAR T cells have come up in a big way in hematology, but there are new trials ongoing in solid organ cells. So these are very exciting. And when you look at the surgical and the radiation aspects of it, even the new innovations and are looking at minimizing toxicity and minimizing the treatment while improving the survival outcome. So when you combine all these 3 modalities, the future is very bright for oncology patients.
And like, what about the medical technologies integrated for like diagnosis and next screening?
Next generation screening for biomarkers and mutations have come in a big way. And the accessibility to that has considerably increased. In the UAE now, it's very easily accessible. And even the drugs that we have, as soon as the FDA approvals are got for the newer drugs, they're easily available in our country now. So that makes it very good thing for patients. They have a lot of options now.
So, is it like whenever new medical technologies are being introduced in the hospital, the doctors are being like trained for that, and how is like Medcare taking care of all this?
We have regular medical education programs weekly in our hospital where the newer molecules and the newer therapies are usually discussed. As a part of our licensing, we do require updates
Right.
for maintaining our license. So that process keeps happening.
Immunotherapy and personalized medicines are transforming cancer care. How do you access and implement these therapies in your treatment protocols?
As far as possible, as I said before, we try to do reflex biomarker testing for each patient, which is by next generation sequencing. So we will get to know what are the mutations that are is seen in that particular
Right.
patient, like PDL1, NTRK, all those mutations. So it's now the earlier approach was like a tissue origin or a organ specific treatment, but now it has changed away from that. It is more of a biology centered treatment. So that is for targeted treatments. With immunotherapy, we have to weigh the benefits of the treatment versus the risk, like the autoimmune risk and what the patient's goals are. And you integrate them and you give a comprehensive education about the side effect profile, and that makes the choice easier for the patient.
So, how is Medcare equipped to handle complex oncology cases, and what distinguishes it from other healthcare providers in the region?
At Medcare, we believe in a continuum of care. The care for the oncology patient has to be in continuum. So we have rapid diagnostic tests. We have daycare infusion centers, on-site imaging. and in partnership with our radiation and surgical partners. So it's an integrated treatment available here. And the backbone of our treatment is MDT. So every case has to go through the multidisciplinary tumor board where we decide the treatment plan for the patient.
Like, what are the biggest challenges you face in oncology practice in this region, both medically and culturally?
One biggest challenge in UAE would be the late presentation of the cases. The reason for that would be the lack of awareness about screening and also the stigma associated with cancer. So, both of these are contributory for the late presentations. Another challenge, I would not call it a challenge, but another thing is that it's a very family centric community that we have here. Be very sensitive as well as transparent when we're disclosing case or the details of the family. So, that is a bit of a challenge when you look at that. Another challenge would be like the on the system side would be because we have new innovations and new cancer care drugs coming in every day. So the insurance approvals and the reimbursements can be challenging at times. But the most important thing for tackling all of this is again education and also a pragmatic approach to sequencing the treatment.
So, looking ahead, where do you see the future of oncology care in the UAE and globally?
In the UAE, as I said before, we have access now to all of the technology that is available globally. The rapid diagnostic kits are easily available now. We have access to all the newer drugs that are available, as well as the FDA approvals are we are also getting access to them. So the future is very, very bright for the patients in UAE because of the access, and they don't need to go abroad for their treatments. All we have a lot of cancer centers coming up in UAE, so it's good for UAE as far as oncology is concerned. Globally, there is, as I said before, there's a shift from organ specific treatment to a histology specific treatment, both in the classification and the treatment of the disease. And a lot of innovation is going on where we're looking at reducing the toxicity of therapy while increasing the survival. So that is a goal, minimum toxic care while maximizing the survival.
What message would you like to give to patients who are currently battling cancer and or those who have loved ones going through it?
Message I have to give is that cancer is just one chapter in your life. It is not your whole life story. Don't let it define your whole life. Ask questions. Ask your doctor. Tell them your priorities so that you can make a tailored approach that fits your life. So the treatment can be modified like that. Treatments nowadays are more kinder. It is less invasive, less toxic. So when we talk about it, we can tailor your treatment towards that. Don't be afraid of cancer. Together with your doctor, you can walk the road of cancer together, each step one by one, and it will be a safe and hopeful experience for them.
Right. Thank you so much. I think that would be all. Thank you so much for speaking. Yes.